To my YouTube channel. In my channel I am going to upload all the syllabus of anatomy for first year students, including upper limb, lower limb, thorax, abdomen, pelvis, as well as CNS. So we have already started with the lower limb session. Our today's topic is femoral canal. So we will be studying this topic under three subheadings, that is introduction, boundaries, and the contents. Femoral canal, it is the medial compartment of the femoral sheath. It is a part of a femoral sheath in which we have anterior compartment, medial compartment, and the posterior compartment. So femoral sheath ka medial compartment is called as femoral canal. It is conical in shape, as you can see in the diagram. This is the femoral canal. It is looking like funnel, so it is conical in shape. It is wider above at the base and narrow below. So conical shape, wider above and narrow below. And it is length is 1.5 cm long and base is 1.5 cm wide. So length also and breadth also both are 1.5 cm long. Base or the upper part of the end is called as femoral ring. The base, this is called as femoral ring. The upper part of the canal is called as femoral ring. This is the femoral ring. Boundaries. Anteriorly it has inguinal ligament. Posteriorly it has pectineus. Medially it has concave margin of lacunar ligament, and laterally the septum which separates it from the femoral vein. So laterally it is the septum which separates it from the femoral vein. Medially the concave margin of the lacunar ligament. Anteriorly we have inguinal ligament, and posteriorly there is pectineus. So femoral ring is closed by a condensation of extraperitoneal connective tissue called as femoral septum. The femoral ring is getting closed by the extraperitoneal connective tissue, which is also called as femoral septum. It is covered with the parietal peritoneum and show a depression called as femoral fossa. Contents. It has a lymph node also called as cloquet or Rosenmiller. Small amount of areolar tissue. Lymph node drains the glans penis in the male and clitoris in the female. So femoral canal is nothing but a funnel-like conical shaped structure which is located in the medial compartment of the femoral sheath. It is wider above, as it is a funnel shape, so it is wider at the base and it is narrower at the end. Upper part also called as femoral ring. Anteriorly that is bounded by inguinal ligament, posteriorly by the pectineus, and medially by the concave margin of lacunar ligament, laterally by the septum which separates from the femoral vein. Femoral ring, it is closed by a condensation of extraperitoneal tissue called as septa. Now septa is covered with the parietal peritoneum, shows the depressions called as femoral fossa. It has one lymph node, some amount of areolar tissue, and these lymph nodes drain glans penis in the male and clitoris in the female. So I hope you understood, and if you want such videos you can subscribe my channel. Thank you.